Well, I'm so excited to welcome Dr. Maren to my Core Connections podcast today. We're going to get in and talk a lot about health in the postpartum and beyond phase of life. But I want to let everyone know that a lot of what I know we're going to talk about today really is really important for women's health in general. So even if it's been 20 years since you've had a baby or you've never had a baby, I still am going to highly recommend that you tune in to this entire episode. So welcome, Christine.
Thanks for having me.
So can you start out by just sharing with everyone a little bit more about your specialty and what you do?
Yeah, so I am a DO, which is a doctor of osteopathic medicine, and I did my training through the Institute for Functional Medicine, which means I am IFMCP. So I have a functional medicine practice where I see patients virtually in Colorado, Texas, and Michigan. Functional medicine, in short, is sort of like root cause medicine. My goal is always to sort of get to the root of what's going on so that we can find better solutions. And I work with a lot of women who want to get pregnant. And so they're looking to better their fertility and improve their preconception health so that they can do better postpartum. And then, of course, I work with them in the postpartum time frame and help them to thrive in that stage of life. I've had 3 kids and have gone through multiple miscarriages. So it's something I'm really passionate about.
So I think one of the biggest things you hit on there was that, like, to thrive after having babies. And I think that is something that as women I've had 3 babies as well, that I feel like some women are not thriving. So can you just speak to, like, what are some of those common things you see? And again, whether it's soon postpartum or even stuff that's lingering.
Yeah, years too, right?
Years,
I mean, it's like into mommyhood. Like, it goes for years, sometimes decades. I mean, I work with women who are moms and they have, 10-year-olds or maybe kids in college. But, after pregnancy, a lot of things can get triggered with us. Autoimmunity is one. I mean, a lot of us go through things like postpartum depression or postpartum thyroid issues. And just in general, the whole process of getting pregnant, going through labor, and then breastfeeding a kid and all of the, demands that come with all of that, and sleep deprivation and the raising our children, our health often takes this sort of backseat to taking care of our kids. And so, it just builds up and it's additive, right? So like the more kids you have, I think the more depleted you can become. It just ultimately, I think, affects a lot of women's health.
So I've seen research out there, just verify this for me if you could, that like with each baby, we get depleted, but more than anything, it's our brain that really becomes depleted. I've read like studies where like it's that 3rd baby.
Are you looking at choline?
I don't know. I don't remember. It's been years because I've spoken to this for years, and I know more recently we've heard a lot more about choline and phosphatidylcholine.
Yep.
Which I know when I was having babies, I had a doctor that put me on like a low dose of it, but I didn't really understand why. So it's very interesting now because I've had Sarah Morgan on, she's talked about the phosphatidylcholine and stuff. So, which is a great episode. So I'll link to that. That's a great one to understand more about it. But if you want to speak to it briefly and explain a little bit of it.
Yeah. Sarah and I are really good friends, and I love choline, as does Sarah. Sarah talks a lot about Mommy Brain. She has a supplement called Mommy Brain that's really good from Vitamin IQ. And our choline, I think what you're referring to is choline because it's additive, and over time we get depleted more and more and more. And there's a lot of factors that can influence that. Diet, of course, is one of them. We get choline primarily through animal foods, so egg yolk and liver or organ meats, which a lot of people don't eat a ton of. And we have a lot higher choline demands through pregnancy and breastfeeding. It's concentrated in the amniotic fluid and in our breast milk. And so the more babies we have, the more choline gets depleted. It is a big deal when it comes to things like methylation and liver health, actually, sleep and REM sleep, neurotransmitter function like acetylcholine. It's an important one.
So from a choline perspective, because I know you said like eggs, which is fine, but honestly, how many eggs a day would you have to eat to get enough choline? Especially if you're looking at like, oh gosh, I've had 3. I have a lot of women, Christine, that have doing my programs, they've had 6, 7, 8 babies. And I'm just like, they are super moms. Like that's amazing. Right. And I just also think of like, wow, your body has become so depleted, and OBs are not telling moms. I mean, I've yet to hear of anyone come back to me and say, oh yeah, my OB told me I should take extra choline. So, what do you recommend from that? And like liver, and there's controversy on should we actually be even eating liver? Because if animal liver is the filter for all the crap, then should we actually be, I don't want to totally steer us off path here, but
no,
should we
I've had the
actually be
same
eating
question.
liver?
I've had the same questions. Yes, all these things, these are all good questions. So choline, so in terms of like how many eggs do we really need to eat? I don't have the numbers in front of me. Good, like large size egg yolk has maybe 200 milligrams of choline. So we probably need about 6 egg yolks a day to maintain that. So if women are eating a lot of eggs and tolerate them well, and they should be good, high quality pastured eggs, great. But some of us have genetic SNPs. So SNP is like a polymorphism in our gene. It's not like a defect. It's just kind of like something that helps us understand that we might need more of a certain nutrient. So in the perspective of choline, that SNP is called PEMT. Some of your listeners might be familiar with MTHFR. So PEMT is sort of like that. And when we have a PEMT SNP, we need more choline. So that person might need, I don't know, 4 or 5 egg yolks. I don't know. Don't quote me on that because I don't know exactly how many, each individual is going to need, but we don't get enough of it in our prenatals. Like very few prenatals even have any choline in them. And then some have a little bit, like 70 milligrams of choline, but it's not enough. We need a lot of choline in our prenatal. So more recently, some of the more sophisticated formulations have them in there, but they're pretty hard to find. I mean, of course, that's what I recommend to my patients. But like if somebody goes and buys a prenatal off the shelf, I can almost guarantee you it doesn't have enough choline. The American Medical Association has changed that recommendation recently. But
so what is the minimum recommendation for choline? Do you know?
For a prenatal, or you mean like during pregnancy?
Well, during pregnancy, but also in that postpartum phase, right? So if we haven't been taking choline, and even if like we've got a mom listening that's like, oh, my youngest is like 10, and I'm still like, can I still take it, and have it be beneficial, right? I started taking more choline with probably a year and a half, 2 years ago. And so my youngest is 8, right? And I don't know that I was doing probably more of the DHA, which I know is beneficial too.
Yep.
There's a lot of things, but I think definitely everyone understanding like the choline is a big thing. Can you explain like, I guess the why behind the choline a little bit?
Yeah.
What it can help us with?
And numbers wise, it's like somewhere between 550 to 930 milligrams, kind of depending on the person. If you're really depleted, I'd go with like 930, especially if you're postpartum, 5 years and you're like, oh, my brain fog, like, or my mommy brain never went away, I'm going to try it. Then I would usually go with higher doses. Sometimes when we use higher doses of things, people don't always do well. So consult with your doctor and see. But I'm sorry, what was your question? I need more choline.
No, that's okay. I wanted you to say those bigger numbers.
Why choline? And you want to know why choline is important. Like what does it even do?
Yes.
So when you are in the preconception timeframe, it's probably just as important as folate for prevention of neural tube defects, because it's a really big deal when we talk about carbon metabolism or methylation. So for people who know what methylation is, we know methylfolate's a big deal, but choline is also a big deal for that. So choline is also really important in pregnancy. As I mentioned before, it's concentrated in the amniotic fluid. So the second highest surgical indication during pregnancy is cholecystectomy, your gallbladder. So part of the reason for liver and gallbladder issues during pregnancy is probably related to choline depletion. So anytime I'm talking to a patient and we're like going through history and she tells me she had all these like liver issues during pregnancy, or she had gallbladder attacks during pregnancy or something like that, I immediately think of choline. It's because choline is a building block for bile. So bile is what we make in the liver, eject from the gallbladder. So it's important for digestion in that way. It's also a big deal with REM sleep and mood and memory because of acetylcholine, which is a neurotransmitter. I'm sure there's some other reasons I'm forgetting. Why else do I love choline?
Yeah,
Those are all big ones though, right?
Those are really important, right? Just if you think, okay, if I were to just add some choline into my diet, you could probably shift a lot of symptoms that are going on because your body's been so depleted. So it's like you've kind of gone into survival mode after having babies. So what are some other things that you see? I know we want to talk about thyroid. I don't know if it's a good time to dive in and talk. And I know so many women listening that have autoimmune, and it's like, oh man, we have babies and it's like autoimmune stuff happens. And I know there's a lot of Hashimoto, so it's kind of all tied in. So I'm going to let you start with where you feel like is the best place to start this whole big conversation around all of this.
Well, let's talk about thyroid and then we'll talk about autoimmune stuff. I mean, just the whole idea of us, we're already maxed out, many of us, before we even get pregnant, right? We live in a really busy, fast-paced world, demanding jobs, whatever. And we don't always take care of ourselves, or maybe we just have a lot of health challenges because this modern day world puts a lot on our plate. Then we go into pregnancy, then we have a baby, and then postpartum we're breastfeeding. And then we're just left really depleted. There's a lot of factors that go into that, but nutrient depletion is one of them. So if we're talking about thyroid function, there's a big interplay between this postpartum depletion and then having a thyroid issue. I see a lot of people who have thyroid issues postpartum that go undiagnosed. And they're like, oh yeah, they couldn't lose weight, or they had a ton of anxiety. And it can go a couple different ways. You can have a lot of different thyroid issues after you have a baby. So one of them is just suboptimal thyroid function or problems with conversion. And so if you don't have enough of certain nutrients which support thyroid function, like iodine, selenium, zinc, some of the B vitamins, vitamin A, all of those are really important for optimal thyroid function. Sometimes we don't have enough of those, so our thyroid isn't performing as well. Also, sometimes we underconvert between T4 to T3, and we make a lot of something called reverse T3. So basically, like, we make a lot of the brake and we don't make enough of the gas. And that underconversion can happen postpartum just because of inflammation, stress, lack of sleep, whatever it might be. It's sort of like our evolutionary process to say, like, hey, put the brakes down and rest, but nobody's resting, right? They're taking care of their kids. They don't have a tribe. Their mom isn't over helping them, whatever it might be. It's not easy and we don't have time to rest. So some people have that underconversion issue. What I look for in thyroid labs is a T3 that's like in the lower range. The range can be like 2.2 to like 4. If your free T3 is in the 2s, that feels terrible. I've been there. It's not good. You feel functionally hypothyroid, but you're not going to be diagnosed hypothyroid by most doctors because they're just looking at a TSH and a T4. So that would be like that suboptimal thyroid function or poor conversion. So the other issue that can happen is postpartum thyroiditis. So for the woman who's like maybe 4 months postpartum and she's like, oh my gosh, I'm so anxious. Like, there's a lot of postpartum anxiety going on, which is very common, right? And maybe she's lost a ton of weight and just feels like really revved up and can't sleep. And then all of a sudden everything goes, that's often postpartum thyroiditis. In the initial stages, they get hyperthyroid and then they'll get hypothyroid. And often it goes undetected because we're postpartum. There's a lot of reasons to feel anxious or tired or, whatever it might be. So postpartum thyroiditis is an autoimmune-like condition. It is not the same as Hashimoto's. Hashimoto's is autoimmune thyroiditis that is caused by a pre-existing autoimmune condition called Hashimoto's, where we attack the immune system. They're hard to differentiate, and sometimes you can't. It's like maybe you didn't know that she had antibodies before she got pregnant. So it's a little tricky and nuanced, but essentially Hashimoto's can get turned on postpartum, as all autoimmune conditions can. We know that autoimmune conditions can be really triggered by pregnancy. And so, if a woman tells me she's pregnant and like she just never got back to herself postpartum, I'm always looking at thyroid antibodies. So they're called thyroid peroxidase and thyroglobulin. But over time, that autoimmune destruction of the thyroid gland creates a thyroid that's not functioning as well.
So with all of this, I'm getting like, obviously it's super important to make sure we're getting the right testing done. Cause I know with standard medical tests, they're not looking at a big enough span of numbers to say like, hey, these are early signs and the earlier we can catch things. And so I'm always like, you've got to be your best advocate. Like if your intuition is telling you like something's off, right? Then it's time to go find a new doctor, find a functional med doctor, right? Someone who like understands these deeper levels of things. And then as far as like the autoimmune goes, like that can all be reversed, correct? Especially again, the sooner we catch it, the better.
So the sooner you catch it, the better, for sure. You're totally right. And I say with autoimmunity, we can put it into remission, but we can't really reverse it. So the thing that I see go untreated, so Hashimoto's, like the conventional approach, if you are diagnosed with Hashimoto's, I mean, usually people are like, that's it. You have Hashimoto's, that's the end. Like there's nothing else really you can do for that. But with an autoimmune condition, our approach in functional medicine is very different. Yeah, so you're totally right. Like you got to catch it early.
So it cut out really quick there, but you said gut, correct? I just want to double check.
Yeah.
You were saying a lot of it's from the gut. So this comes up in so many conversations. It's like gut and stress, right? Like lifestyle things really can affect. And so the sooner that we can start to recognize these things and take our health into our own hands and work with the right doctors, the sooner that we can, like you said, so if we can actually quote reverse it, but we can get it to where a woman can function in life normal and not have autoimmune symptoms.
Yeah, totally.
Yes.
Totally. Yes. And then, in that case, it's like it ebbs and flows, right? Health is not linear. Sometimes we have flares, like stress happens, infections happen, whatever. But so it's something to keep an eye on for sure. But yeah, you can get those antibodies to go away.
So with women, I know you mentioned like anxiety, right? Which I think is becoming just a more prevalent, either we're talking about it more or there is becoming more of it. That women are experiencing more anxiety just in general. But what about on the side of like, when we say like postpartum depression, which again, I'd love for you to speak to that a little bit. Cause I know for me, I probably dealt with it the opposite, where like it didn't feel sadness. It almost was like more anger. I had like no patience. And you almost feel like you're like, who is this person in this body? And mine, it completely went away after I quit nursing my daughter. And it was like all of a sudden, I think it was probably about 2 months because it takes time for those hormones to leave your body. It was like all of a sudden I was like, oh my gosh, I felt like I just got me back. Right. And so I think so many women do feel like that, but they don't know what to do about it. So is that a little bit of thyroid stuff going on, or depletion, or just an imbalance in hormones, or like the whole thing, right? It's kind of all connected.
Yeah, it's a good question. I mean, they're separate things, right? Postpartum depletion, thyroid issues, postpartum depression. They're all separate things with like a whole lot of overlap. And you could have them all, right? Like one doesn't exclude the other. It probably perpetuates the other, right? So postpartum depletion, I think when somebody has postpartum depression, obviously it's a very real thing, but I generally think of depression or mood symptoms as symptoms, not as a disease, So it's like, yes, it's a diagnosis, but it's not like, well, but why do you have it? And so it's probably related to the postpartum depletion. I mean, obviously there's like a component for most people of like social isolation and really changing your role in life. And then also thyroid, like you got to check your thyroid if you have postpartum depression. I always think that's a really big question. Like, is it postpartum depression or is it hypothyroidism? Because certain people are more at risk of mood issues from thyroid. So it's kind of going back to that genetic stuff.
Yeah.
But yeah, certain people will have more mood-based symptoms.
So I think this is so important to understand, because we've never talked about this on here, and understanding that our thyroid can really play a role in how we feel. So I wonder if I was having some thyroid stuff going on, which also when you're breastfeeding, I would assume maybe those hormones can also play a role in thyroid function. Yes, maybe.
I don't know. Not like a direct role. I mean, I'm sure there's something like there, but I mean, sex hormone binding globulin is sort of the big one you think about during pregnancy, but depending on it depends. If you have a high sex hormone binding globulin postpartum, which you may, especially if there's estrogen dominance, we tend to make more sex hormone binding globulin. That's SHBG. So if you have a lot of SHBG, it decreases your bioavailable hormones. So your bioavailable free T4 or free T3 might be lower. So there might be that interplay. And then also the nutrient one, because if you have a lot of nutrient demands, it's going to your breast milk and not, to support thyroid function.
Right. And then you're sleep deprived. So when you
totally.
When you stop nursing, right, there's a multitude of things that happen, right? You stop having the depletion just being sucked out of you, right? And then you start sleeping a little bit more because you're not nursing or whatever that might look like. Some women are more scheduled with that than others. I probably was not scheduled at all. I don't even remember. That was like years ago. I've forgotten it all. And then you do get a shift in hormones. And like, so it's kind of a little bit of those couple of things could actually help you to start feeling better. But for women that definitely don't feel better after how long do you want to give it after you say quit breastfeeding if symptoms are still there that you're like, you've got to go and get stuff tested?
Week. I mean, I think everybody who's postpartum needs to be tested, like we all have depletion. We just need to figure out what it is. And you jogged my memory, like when somebody's breastfeeding, the way it might affect thyroid is a high reverse T3. If they have all these demands going the other way, they're not getting, especially if you're not getting enough calories, you'll make too much reverse T3. So you'll like slam on the brakes.
So would that be a sign if like you have a hard time having enough milk supply?
Oh, thyroid is huge. Yeah. If your like milk supply drops off, I always think about thyroid.
Oh, interesting. Oh, this is such good stuff. Thank you. Mm-hmm. So here's a question, because I get a lot of women that will ask, well, how late? Like I had, we talked about the Dutch tests a couple weeks ago, right? And I had Dr. Carrie Jones on talking about that.
Awesome. She's so good.
I love the Dutch test. I've done it multiple times myself. Too. And so I get women that like, it's when you're breastfeeding and after pregnancy, right? Because there's so much shifting happening. Like how long I know you said like testing, but when should you be testing for this stuff? Because stuff is shifting so rapidly after you have a baby. And right? It's like,
I mean, when it comes to thyroid, I think everybody should have a full thyroid panel 4 to 6 weeks postpartum.
Okay.
I think postpartum care in our country is pretty abysmal, and it's not the OB's fault. I mean, the ACOG, American College of Obstetrics and Gynecology, has like a new position statement on postpartum care. It's just implementing that care that's somewhat difficult because insurance companies don't reimburse for it and they can't work for free. And, it's like, how do we create a different culture where we support women postpartum and they have better postpartum care? I do think telemedicine is now becoming more accessible. Like, I get to see people virtually when they're like nursing their baby from home. They don't need to like drag the whole family across town for 6 hours, right? So I think telemedicine and virtual care will probably play a role, hopefully, with this, but see somebody postpartum. And, it's traditionally like my postpartum visit was literally like 10 minutes just to make sure I was still alive, like I'm good, but I'm not good, So there's a lot. And I think that women need more support and more help. It's just a question of like, who's going to fill that role? Mm-hmm. And I think at this point, I would just say, like either your OBGYN or your primary care doctor, or if you work with a doctor like me, who's, a functional medicine trained doctor, I think that would be ideal because they're just a little bit more like detail oriented about thyroid and all of that. But I do really strongly believe every woman postpartum should have a full thyroid lab with thyroid antibodies checked. And I'm going to say like 6 weeks is generally when I do that. Yeah.
I think that's wonderful. Thank you for sharing that. So once we get beyond the breastfeeding stage and, you've got a couple kids and you've gone off with life and you're working and running kids around to activities and your youngest is like 10 or whatever, right? So what do we do in that kind of beyond the first year of postpartum, because you're still postpartum. And I like to always preach this. And like women think they're not postpartum after 6 months, usually is kind of the answer I get. And I'm like, once you've had a baby, you're always postpartum. And we have got to address the lingering things that are going on with our body from pregnancy, postpartum, breastfeeding, exhaustion, like you name it, because it only is going to get worse if we don't do something about it. So when we're talking about thyroid, how often do you recommend that women test thyroid? And do you recommend thyroid antibodies every time they test thyroid?
It depends. So
Okay.
for somebody who has Hashimoto's, I like to check in on those antibodies like every 3 months. I mean, if they're on stable medication, maybe every 6 months or something. But when I'm working with patients and maybe I identify, like there's a lot of women I work with who are, they have like a 6-year-old at home and they're like, I don't know, something's just not right. I don't know what it is, but something's just not right. And we find thyroid antibodies. Like I can't even tell you how many times that's happened. And they had no idea they had Hashimoto's, and their TSH is actually still pretty normal. So, it's Hashimoto's and we work on that. But for them, it's like, yeah, about every 3 months, I'll check those antibodies. That is, you're going to hear different things from different people because, even I've been at a conference before with an integrative sort of instructor who said, why check them again? But I totally see them come down. Like that's how I know that I'm doing the right thing is if those antibodies are downward trending. If they're not downward trending, we need to figure out like what is the root cause for the Hashimoto's that's not being addressed. So I think ideally women should have a thyroid panel every year just with their yearly blood work, like a CBC and a CMP looking at like kidney and liver function because it's so prevalent.
Do you have, after this call, could I get like the exact like ranges and tests and all that? And we can put it in the show notes so everyone can be like, this is the things that you can go ask your primary care doctor to order for you. And I like how you said earlier with telemedicine. Like, I think it's great. I do that with mine as well, as you can just have phone call conversations a lot of times, and it saves you so much time. You don't have to go anywhere, and then they order your lab work, and all you gotta do is go in and get it lab work done, and then it's like easy peasy. So I think we need to start asking for that stuff, especially once we're out of all this quarantine stuff. But no, I think this is stuff that women are more familiar with, but we still, I think, have a lot of questions of like, when should we be testing and what exactly should we be testing? Because if you go to a traditional medical doctor, they're looking at really smaller ranges and they're not testing for as many things. So
yeah. And I'll say too, timing is kind of a big deal with thyroid. So for people who are on thyroid medication, like somebody who's on Armour or like a natural desiccated thyroid, I like to have those labs drawn 4 to 6 hours after they take their medication, because that's the only way we really understand their T3. So for those of you on a thyroid medication, if you're on like a T4 only, like levothyroxine or Synthroid, I'll just do the labs before they take that medication first thing in the morning. But for people on a T3, I want to see the labs drawn after the medication is given.
No, that's really good advice. I've never heard that. Thank you. Okay, so what else beyond thyroid and
so autoimmune stuff?
Autoimmune.
Did we dive into the Hashimoto's enough? I don't know. I
don't know. I think the biggest thing out of that, right, is like testing. I think that's a good place to start, right? So are there other autoimmune things that you're seeing? I know Hashimoto's is the big one. That's what
Hashimoto's is like, probably the most common, but yeah, for sure. There's lots of other autoimmune stuff, right? Like people could have, all the autoimmune issues, there's a big spectrum. Hashimoto's and Sjogren's are not fun, but they're less severe, right? And then multiple sclerosis and, maybe ulcerative colitis and Crohn's disease. And there's a lot of different autoimmune diseases, rheumatoid arthritis. All of those things can pop up postpartum, but the one that's most common is Hashimoto's.
So with all those other ones that you listed, is like, I know we don't want to go into each of them, but from a like working to decrease the symptoms, we can do that with a lot of lifestyle stuff, checking to make sure like regular, our list of labs is coming in at normal, or what is that feedback on that, right? What are we eating? How are we moving our body? And how are we sleeping? Like those are really big key things. I find like sleep is a really big one. I think that, we're so depleted on sleep. I've worked on my sleep a lot these last couple of years. I track it with my Oura Ring, which was very eye-opening to me. It's interesting when you can start to track like what you do in the evening, how it relates to your quality of sleep. Like if I go to sleep 15 minutes later than what it like says is my ideal time, I just don't get as high of a score. And then I'm like, I didn't get as good of sleep last night. Like you can feel it even before I look at it. I can tell you like what my number is now. It's crazy because you start to make these connections. But as far as like some of those autoimmune, like what's your best advice on
so
in general?
you can help your antibodies. That's my best advice, is don't accept. I mean, you will have an autoimmune disease. So I have autoimmune disease. So many women have autoimmune disease. It's kind of not if, but when for some people, So, I mean, not like doomsday, but it's just like, unfortunately, our environment sets us up for that. So there is a triad with autoimmunity. So 3 things. So number 1, there's a genetic predisposition. So, there's not a ton we can change with that. I mean, we say genes load the gun, environment pulls the trigger. So that's why 2 people with the same genetics can present very differently. So then number 2 is environment. Environment might be something like some mold exposure that somebody's had that's triggered something, a big stress or loss they've had. It could even be certain foods, like maybe gluten or something, if they're gluten sensitive. That's going to also affect gut permeability, which we'll talk about in a second. But for many years, we've accepted, like, the conventional paradigm is that genetics and environment sort of play a role in that. But I think the environment piece is under addressed many times. But then the third kind of newer approach, and the approach we take in functional medicine, is gut health. And so there's a lot of research that links zonulin, it's a protein that's with certain gut bacteria, and with gluten. So that's when, if somebody has an autoimmune disease, I always recommend a gluten-free diet, because of the research that links zonulin that links gluten to zonulin and increased intestinal permeability. And then I look for gut infections. So things like bacterial overgrowth or fungal or candida overgrowth, parasites, I mean, all of that can be a big setup for gut. So yes, when somebody has an autoimmune disease, I'm usually focused on their gut.
Yeah, gut. Always comes back to the gut.
Yeah.
How do we fix and clean up that gut? Which, again, you can do so much with diet. And I've been gluten-free for long time, many years. We are gluten-free in my house, and I've helped so many people get off of it. And it's always, in the beginning, I have some people that are like, how do you do it? It's so hard. And it's like, you just have to take that first baby step and not try to be perfect with it. And the more you just start to do it, it becomes part of your life. And then you start to realize how good you can feel. Because I think there's so many women out there that don't know how good they could feel, because it's gotten to a place where you just kind of feel tired all the time, but you've learned how to push and push and push. And we're seeing so many health things at a much younger age. And with what I teach with like movement, I see so many things in the physical aspect of the body that I know is not just physical. It's because we've got increase in inflammation and all that kind of stuff. So
yeah, totally.
It's kind of, I don't know, it's just one of those things where I feel like we all can do things to improve upon it. But it's hard because there's so much in society, and the food system and all that, that's kind of like pushing against us. So we have to like work that much harder to weed through all of that.
Yeah. And like you said at the beginning, we really have to be our own advocate. Like I feel like we have to be really like in the driver's seat with our health, but find somebody who we can team with to like help figure stuff out. I mean, that's the other side, is like, some people will come and see me after they've been like on a super duper elimination diet for 3 years, and like, they kind of throw in the towel because they're like, I don't know what else to do. And it's because they haven't addressed the underlying gut issues usually.
Mm-hmm. Yeah,
I mean, there's
absolutely.
a lot else to it. Like, as you know, there's mold issues and like all sorts of environmental stuff that could be at play too.
Yeah. So what else do you see commonly in we could just say moms, right? Because that's basically what it is from a depletion perspective, besides what we've already talked about. Like, what else do you see is pretty common?
I mean, what about low libido? Like,
oh yeah,
let's talk about have an awesome libido, right? So I think that's where a Dutch test can be really helpful, because it's like, what is going on with our hormones? And I think of libido as a symptom, sort of like mood. It's like, if we don't have a great libido, then why is that? Like, our body doesn't want to necessarily procreate if we're not in a good, healthy spot. So I think it's just sort of the symptom of like underlying issues. It can obviously be really related to hormone imbalances. So probably when you talk to Carrie about the Dutch test, she addressed maybe some of this, but like looking at your testosterone levels and looking at your progesterone to estrogen ratios, basically. So people who don't have enough progesterone often have an issue with low libido.
Yeah, I think low progesterone is so common.
Oh yeah.
So what do you
Totally.
recommend with for women that do have low progesterone? Do you
I usually use Chaste Tree or Vitex.
okay.
I mean,
Yeah.
obviously the lifestyle stuff too, like stress and meditation and, all of that, and sleep, all that's a big deal. But yeah, in terms of supplements, I'll use Chaste Tree or Vitex. Sometimes I'll use topical progesterone. And in some women, I'll use oral progesterone.
Do you find that most women with just the supplements addition that helps them quite a bit?
Yeah. I mean, for some women, it depends on the age range, but like in our age range, yeah, supplementation will help. But I think it can be other things at play too. So often it's like too much estrogen in relationship to progesterone. So you have to boost progesterone, but also help to detoxify some of the estrogen. So, you can use other supplements to help with that, like DIM and calcium D-glucarate. You just have to be really careful with those. Like I always like to have labs before I use those because you don't want to deplete your estrogen too much.
Right.
But a lot of women have too much estrogen on board because there's xenoestrogens and other sorts of environmental influences.
Yeah, the estrogens is so interesting. Like I discovered, and maybe you can speak more to this, is that we have so much more estrogen, like obviously in our female organs, our uterus, and which makes sense, right? When you typically think of, and this is just my perspective, knowing what I've known about the body all these years, is like when you think of estrogen dominance, you tend to think of, women that have more weight around their midsection, right? That's kind of more of that classic, like they've got too much estrogen. But for women that don't, you can still have too much estrogen, and it's coming from because you're not detoxifying, and it's just like hanging out in your uterus, basically, which can then lead to like symptoms of like clotty periods and heavy periods, because that's a big sign, right, of too much estrogen.
Yeah.
Correct?
So when I think of too much estrogen, I think of someone who has really heavy or painful periods. Like your period's not supposed to be painful. It's not supposed to keep you home from work, right? So somebody who has like really heavy or painful periods, somebody who has PMS, some breast tenderness. Sometimes people have like growths, like fibroids. All of that is usually like too much estrogen. So mood also is involved here. And then with too much or with too little progesterone, I think about like sleep issues, low libido, some anxiety, and then the imbalance. Just once you can like get them more like balanced, it just feels better. And then cycles are more normal, and people start to normalize.
So do you find, kind of circling back to where we kind of started our conversation with, when a woman's able to get her choline stores boosted up, do you find that can positively affect her hormones? And I would think her mood too, right? Because it's affecting the brain.
Yeah, for sure. Mood, hormones. How would it, it helps with liver. So yeah, probably it's sort of indirect, but when I think about your estrogen detoxification, it's phase 1, 2, 3. So phase 1 is in the liver. Phase 2 is through methylation using a gene called COMT. And then phase 3 is basically in your gut. So for women who are constipated, that could be a big issue. Back to gut health, right? But
Always.
yeah, I think choline will probably help the liver, which will help estrogen detoxification.
Yeah, but like you said, if our gut is backed up, then we've got some issues, because we're just stacking the estrogen as well as other toxins and things in the body. Yep. So can you speak to that? Because I think a lot of women deal with the constipation. What's your initial kind of like to get that moving? And I'm talking women who eat generally pretty healthy. Yeah. I don't know if they're gluten-free or not, but I would say in general, women that listen are, they eat pretty healthy, right? Yeah. Is it perfect? No, but none of us are perfect. So what's your first step to like, because the constipation thing is a real thing, because you should go like 2 or 3 times a day. Yeah. Right? Almost every meal that you eat, or if you feel bloated a lot, right? Those are big symptoms of, I know if you're bloated a lot and you have SIBO, that's like bacterial overgrowth. So that's a big one. Yeah. Yeah.
So that is, if somebody's constipated and it's pretty severe, that's when I look for methane predominant SIBO. Sometimes there can be other gut infections causing things like that, like fungal overgrowth. I would say generally with like fungal dysbiosis, I see more loose stools, but it could go either way. So that, and then food sensitivities. So like an elimination diet. And then just like Magnesium's a big deal too. So we need enough magnesium. There's also, our gut has a nervous system. So we have to think enteric nervous system, thyroid. We go back to thyroid. Like if somebody's constipated, a thyroid, like hypothyroidism is, we know hypothyroidism causes constipation. Like everybody knows that, right? But it's often just kind of overlooked, or maybe there's suboptimal thyroid function or poor conversion and the T3 doesn't look good. So we just have to think about that gut motility. So there's a lot of factors there, but I mean, like you mentioned, SIBO and gut infections, enteric nervous system, and like that sympathetic parasympathetic balance. So it's our nervous system. Parasympathetic is rest and digest. So sort of tending to that, making sure digestive enzyme function is good. So some of us have issues like with pancreatic insufficiency. We don't make enough digestive enzymes. Everything gets slowed down.
What do you recommend for that? Because I know there's a lot of natural things. Like I do bitters. There's one other one that I do, and I'm totally drawing a blank of what it is, but it's herbal of some sort. No. What do you think about oxbile? Because I've kind of heard both sides of that, where like it can be helpful, and I've also heard maybe you shouldn't take it.
No, I mean, it depends. I don't use it in everybody, but for people who've had their gallbladder taken out, I recommend it with meals. Okay. So I use oxbile often. I'm looking on my desk to see if I like have any of these digestive enzymes sitting around. I'm a fan of digestive enzymes and also HCl. So it's
especially, I said, so HCl, especially if you're going to eat meat, correct?
Yeah. And it's, like, and not everybody needs it, you know, like some people don't need it. Not everybody needs digestive enzymes. That's like why I work with patients and try to figure out what they need, you know, but for patients who have a elastase on like the lower level, especially if there's been mold exposure, that can be linked to pancreatic insufficiency. And so they may not make enough digestive enzyme, and then the SIBO or the gut infections just keep coming back, or they're super constipated. So I like digestive enzymes for certain people, oxbile, and I'll test HCl in people to see if they need 1, 2, 3. Sometimes people need like 4.
So what kind of tests do you do to test for that?
Yeah.
I've never done a test for that.
So you can just do it on your own. People call it the HCl challenge test. So you basically take 1 pill of HCl with a protein containing meal. And if you don't feel anything with the next meal, you take 2. If you don't feel anything with the next meal, you take 3. And you can kind of keep going up. I mean, you don't want to take more than like 6 or 8. And you definitely do not want to open the capsules.
Okay. What would you
feel? Like a burning sensation, almost like reflux or GERD, heartburn. It's kind of like a warmth and a burning.
Okay.
I've gotten there. It doesn't feel super comfortable, but it's not like terrible. But often people are like, what am I supposed to feel? I don't feel anything. I've like taken 8, you know, and you're like, oh, well, that's hypochlorhydria. So there's an invasive test in medicine where they can like drop something down and test stomach acid, but obviously it's invasive, it's expensive.
Yeah. Do the easy experimental test.
Yeah, you could do the easy experiment is just use some over-the-counter HCl and sort of test and see how your stomach acid looks.
Okay, so I have a question with the enzymes. So if you start taking them, does that mean you have to take them for the rest of your life? Or is there maybe just a period of time, because then you can work? Because that's why I've always tried to take the bitters, is right, supposedly it's supposed to help naturally get your stomach to start to create more. And I mean, my SIBO and stuff all went away, which I got with the mold stuff, right? So that's not a problem anymore. But sometimes I'm like, wondering when you have that feeling of you eat a meal and you feel like you just have a heart, like it feels like it's still almost like in there in 2 hours later, then that's a sign you're not digesting, especially if it was a meat, like beef especially. HCl. So that's when you take HCl. Yeah. Then does that mean I have to take it for the rest of my life?
No, it doesn't.
Okay.
And there's, you know, I don't know I don't think anybody really knows the right answer to that. You know, it's like, I like bitters too. So I didn't mention bitters earlier. I love bitters. I use it too. It's like one of my favorites. It is like a really great natural way to stimulate your gallbladder, but some people need more. And it just depends, you know? So for somebody who's not challenged with a lot of issues, bitters can be awesome. I mean, it could still be awesome for somebody who is challenged, but they might also need pancreatic enzymes on top of that. I'm just speaking from my own personal experience.
Yeah, no, that's what I do too. I'm like, well, this is what I know.
Yeah. I mean, I have obviously a lot of other experience working with patients. So yes, like what I tend to see and what I saw was like, I needed a whole bunch of enzymes and a whole bunch of digestive support. And after like 2 years, I could feel like my stomach acid kind of came back. So
Okay.
it took a long time.
Yeah.
And I've had other people have this sort of same experience. So, it takes a long time to sort of fix all these underlying issues, how things are. Like things don't get better in 2 months. Like we have to sort of unpeel the onion
Yeah,
and fix
absolutely.
things.
So what else from, like, I know you mentioned it, like, okay, because our gut is so reactive to our nervous system, that just even when we can start to relax a little bit more, which
Yeah.
I actually find is really hard for women, especially when you're used to like go, go, go. When you
Yeah.
actually start to slow down, like, do you find that people can actually improve their gut function if they just like after like eat a meal, focus on your food you're eating, and then allow yourself just a little bit of time to just like
Yeah.
relax after so your body can actually digest? Do you find that just that alone can help to heal the gut? Because we don't just go boom from eating while we're driving or watching something or doing whatever to like the next task.
Mm-hmm. Yeah, you're totally right. I mean, it's like that parasympathetic and sympathetic dominance. So like good good food or eating hygiene, I say, is like don't eat when you're mad, sit down, chew your food. Don't drink like a ton of water with your food because you dilute all your digestive enzymes and stomach acid when you do that, especially like cold ice water. So people who are drinking like a giant iced tea with their meal, it's like not great for digestive function, right? So yeah, just sitting down and relaxing and allowing your body to sort of digest and absorb that. And also like part of what can help with digestion is just cooking and preparing food, like smelling it, sort of preparing your body for that. So yeah, and I don't know that it can really. I think the thing that goes unrecognized is when people have some underlying gut infection that they have no idea about because nobody's testing for it,
Mm-hmm.
and you can't cure that with food alone. I think food's important. Obviously, it's a big cornerstone because you're not going to get better if you don't fix the food part. But it's not, I don't think it can really be a cure for people who have, a lot of dysbiosis or fungal stuff. Depends on severity. So I think our bodies are designed to heal themselves, but sometimes we need to nudge them a little bit more,
So
get them back into orbit.
as far as gut, then what do you have recommendations on like testing, like for
Yeah.
gut
So a
dysbiosis?
lot of gastroenterologists will test for SIBO in their office. They'll do a breast test. So often, at least last time I checked, they didn't differentiate between methane and hydrogen predominant SIBO. But I mean, you pretty much know what you have. If you're really constipated, it's methane predominant. If you're not, it's hydrogen predominant. So, you can do a test for SIBO. I do at home tests for SIBO, like I do a SIBO breath test. But honestly, I more often test what's called an OAT or an organic acid test. I don't even do the breath test that often anymore because I get so much better information from an OAT. So the OAT, the organic acid test, is actually a urine test. And we're looking at metabolites for fungal burden. So things like aspergillus and candida. And then also looking at metabolites for bacterial overgrowth. And so that information, when I look at an OAT, I can get kind of a better feel as to like if this is a really heavy candida burden or just more bacterial. And then I also like to do stool testing. That's a little bit like I interpret it with caution. I do a GI map usually looking just, one, depending on the person, but if it's somebody who has digestive issues, food sensitivities, or autoimmunity, I always want to rule out like parasites or worms, or at least evaluate for that. And then look at other markers. So on the GI map, you can look at good bacteria and bad bacteria, parasites, worms, yeast, some viruses, and then lots of markers for intestinal health. So markers for things like inflammation, estrogen reuptake in your gut, immune system of the gut. It's called secretory IgA. And so those two tests together give me a pretty good picture of somebody's gut health.
Yeah, it's a lot. It's a lot of awesome information that we can now find out. Like if you had to recommend, because I've done all of those. I'm
Yeah.
like the person that loves like to figure out tests because you can't just, otherwise you're just guessing, right? And
Mm-hmm.
there's some things you can experiment with, like the HCl, like you said.
Yeah.
Like I think that's great when there's certain things you can just be like, well, it's safe and I can just kind of experiment. But when you can get these tests, you can much easier pinpoint things. Would you typically do like an oats test though before a stool test? Because I think I know with the stool test, you got to be careful which one you're going to do because there's a handful of them out there, and there's ones that are
Yeah.
definitely better
Yeah.
than others for sure.
Yeah. I mean, I actually, yeah, I like the oat better than a stool test, even though we're evaluating GI function. I get more information from the oat.
Yeah, that's what I was wondering, because I feel like the stool you don't get too much on, and
Hmm.
it could be a little bit like, I feel like you could do two different tests and something might show up on one
Oh,
and doesn't
totally.
show up on another,
Yeah,
right?
totally. You'll
So
get like one bacteria show up and then like the bacteria might be different. I just kind of, when I interpret that, I just kind of walk people through it and like let them know the shortcomings of these tests. They're not perfect tests, but we can see a trend. And if we see lots of like the bad bacteria, we know there's dysbiosis.
yeah,
And I'm not prescribing an antibiotic. I'm prescribing more broad spectrum herbs for dysbiosis most of the time anyways. So it doesn't change my management, because it were targeted therapy and I was like prescribing something for strep or for pseudomonas or something, I would probably handle that a bit differently, but I'm not
right. No,
using herbs.
this is such good information. I love it. You use herbs because then you're getting rid of the bad stuff and keeping all the good stuff.
Yeah, I mean,
Right?
herbs over time can be like an antibiotic too, so it's like you don't want to use them forever. And I don't always use herbs. I mean, sometimes I'll use pharmaceuticals,
Yeah,
especially if
you
somebody
have
has a
to
lot of
sometimes.
fungal burden, or had mold exposure, I'll use antifungals. Or sometimes ifaxin, for SIBO occasionally, but I really am very careful about the yeast component when I do that.
Yeah, this is such good stuff. So is there anything else you see? I know again, we always come back to gut stuff, but this is good gut stuff that we haven't talked about before. And, people to be aware of, like the oats test, which can be very, very eye-opening. Especially, again, you have to work with a functional med doctor that understands the oats test. I don't know that your standard family doctor is going to know what to do with an oats test. So.
Probably not.
Yeah. So all of this, even, and again, this stuff is really good, whether even you've never had a baby, right? But these are a lot of things that tend to come up because things can get triggered from being pregnant, giving birth, nursing, depletion, and all of that. So is there anything else that you really want to add that has to do with any of this? 'Cause I know we
I
could
think
talk about all day about a lot of things, but
Yes, I know. I mean, I just think like movement and sleep hygiene, and I mean, all it's a big deal. So for people who don't return to, a good sleep cycle, I think that's something to definitely address and figure out why, whether that is related to neurotransmitter function or nervous system issues or whatnot. I also talk a little bit about Wi-Fi. I always ask my patients to turn their Wi-Fi off at night, and just try to really like give yourself space to like calm the nervous system and um, and sleep, because that is a really big pillar.
yeah, you could do all this stuff, but if you don't start to get a handle on your sleep, it's just like a tug of war within your body,
Totally.
right? Yeah.
Yeah.
I'm with you with the Wi-Fi. Ours is always off at night. And we've even got like the cell phone cases. I don't know what you think about those. And like, if the computer's ever on a lap, I've got the like
Yeah. I have
safe.
that right here in front of me, my
Yeah.
Defender Shield. Cell
Yes.
phone cases, like, I don't know, I used to have one. And then the Environmental Working Group has a safe cell phone guide, and they actually recommended against them because I think they feel that it provides a false sense of security.
Mm.
I don't
So
know.
I was looking, I'll just ask you. So this one, the ones that I got, it's what is it called? It's safe something, but they just have it like for the front of the phone. So like the back isn't protected, because they say if you actually have it like fully protected, your phone wouldn't work, for
Right.
one, but it's supposed to shield it. So like if you have it in a pocket, it's at least like reflecting it
Yeah,
away from your body. I don't know.
that
I think
makes good
it's,
sense.
so again, it's like you said, don't use it as an excuse to have it on your body more. But, like with my 13-year-old, I'm like, try to get her to like not carry her phone with her, but she likes to listen to books on tape. And I'm like, oh, how do you argue with that? So it's
Mhm.
like this fine balance of, I'm like, okay, well, I hope this is working, but
Yeah.
yeah, I don't know. Be smart
A
about it, I
Wi-Fi
guess.
meter. Do you have a Wi-Fi meter at home?
I do. Yeah, you're right.
Yeah.
I haven't tested it. Yeah. My
I
mom
kind
and
of
I
like those. I mean,
borrowed. I need to get it back. Yeah.
yeah, yeah.
Yeah.
It's
Test it
interesting
out.
because you're like, oh, my printer. Forgot about that.
Yes. I know everything. I know we need to be hardwired and more instead, but
Mm-hmm.
then who wants wires running all over their house? So,
I know.
but EMFs, and people are more sensitive to EMFs And they realize, and I would say, I'd love to know your thoughts real quick on this, is like, for people that are a little more sensitive to things in general, they call the canaries. That's me, that's you, right? Like we tend to feel these things. I've heard that like people that get ringing in the ears, that's an EMF like reaction.
Oh, interesting.
I don't
know. I would buy it totally. I mean, I actually had my house tested. So somebody came over, she had like all these crazy tools, like very, my little EMF sensor is like $100, right? Like,
right.
She has these very fancy things, and we shut down everything. And I was like, oh, wow. Like,
good.
There's a quieting. It's sort of like when you go camping, there's not there actually probably are a bunch of EMFs around you because your neighbor over there has like some sort of cell tower in their tent, but so they can watch Netflix. But it's just like that feeling of, I can totally feel that. But I mean, I don't know. I'm not sensitive enough to tell kind of that stuff. There's certain people who are very like, they can feel it like off of.
Well, and I think when you tend to be healthier and you've gotten stuff out of your body and all that, you become less sensitive because you can tolerate a little bit more. But I agree with you on that. Just feeling like when the internet's off at night and you just like have that sense of just like, it's quiet, and it's a weird feeling. So everyone should try it. If you haven't tried it yet, just unplug your Wi-Fi.
Yeah. I have mine on a Christmas tree timer because I wouldn't remember to unplug it. Like,
it's a good idea.
I just forget. It's like not the thing you think about. You turn off all the lights and I just wouldn't remember that thing. So it's on a Christmas tree timer. And even if my husband and I are watching a show at night, it is 10 o'clock and that show is off. And it's like last night this happened to us. It was like, what's going to happen? And then the internet goes down and we're like, oh.
And then you're like, but it's all right.
But it forces us to go to bed. And so it's like totally good for us, like, you're welcome. Now we're going to bed.
I know. And especially with all this, I feel like it's been too easy to stay up a little later. And it's like, no, we have to. I'm like, but then I feel so much better when I make myself go to bed within my 9:45 to 10:30 time. I feel like an amazing person when I wake up in the morning. So it does make a huge, huge difference. So
yeah, for sure.
Well, Christine, will you share with everybody where they can find out more about you? Maybe they're interested in working with you, or they just want to follow what you talk about on social media.
Yeah. So my website's Dr. Christine Maren. So ChristineMaren. And then I'm on Instagram and on Facebook. So just Dr. Christine Maren. I'm on Instagram a lot. So leave me a note if you watch this episode and say hi.
Yes. Thank you so much. This is so wonderful. So much good information.
Likewise. Thanks for having me. I'm going to go back and listen to your interviews with Sarah and Carrie Jones because I know those are going to be really good ones.
Really good ones. Absolutely.